Welcome back to the Dog Pod. In this episode, we're going to talk about IVF. Now, did you know that global celebrity Kim Kardashian freely discussed her personal experience with in vitro fertilization, in other words, IVF? She bravely shared her fertility troubles in 2015, like clearing up the myths about that celebrities do not have fertility problems like many couples have or endure. Also, Kim has opened to talk about her experience with IVF and also shed light to this subject, which is kind of frequently disguised or hidden from everybody. Kind of like if it's something to be ashamed of. Okay, so today I'm here with my co-host, Valentina Neise, and with our dear guest, Micaela Leon. Now, do you have any questions, Micaela, with this topic?
Yes, but my aunt is going to have an in vitro fertilization, and I don't know really what is that and how it works.
I could explain it to you. First, they will give the woman, they're going to extract the egg, fertility drugs, which contain a lot of hormones that are going to make her produce more than one egg each month. She will receive
Women have eggs?
Yeah, their ovules.
Oh, okay.
Yeah, in your uterus you have that. So yeah, they're gonna do her a lot of ultrasounds and blood tests on a regular basis, so they check that she's producing more than one egg. Then for remove the egg, during that procedure, there's a thin needle guided by an ultrasound will be introduced to remove the egg from the ovaries. They will sedate her from the waist down and all that. So because it's they put a needle inside her vagina. So yeah, it's a little bit it gives up the ick. But yeah, that's how they extract it.
Yeah, I think because it's too painful, right, Valentina?
Yeah, imagine yourself getting a needle inside your vagina, so to extract an egg.
Your hoo-ha.
Oh my, yeah, that will hurt so much. Okay, but continuing with the process, then there's two options. If the woman have a partner or something like that she wants to have the baby, they're gonna extract the sperm from him. In a cup, a regular they donate, or he can use a donut of sperm. She choose between all of them, and she choose the best one for her. So that.
Yeah, my aunt is choosing a really sexy guy because she have not a partner really, and
She wants her babies to be sexy.
Yeah, really sexy.
And continue with the process. Then they're gonna mix introduce the best sperm there is with the best eggs there are. So it's called insemination. It typically takes a few hours for the sperm to fertilize an egg, and when it's fertilized, they're going to introduce that fertilized egg into the woman. They're gonna put into her multiple embryos because they need to attach into the uterus. So yeah, and if it's successful, the woman can have between 1 to as many embryos they implant into her if all of them attached. So that's the process.
And there are some risks, or is super safe?
Okay, so yeah, I know something about that. I think there's something called ovarian hyperstimulation syndrome. Basically, I think that's one of the risks. There's more, but this is I think one of I've heard before. First, they use when they use injectable drugs to prepare you for all of this process and the fertility and all of that. Sometimes this can cause this kind of syndrome, which the ovaries can become swollen and cause pain to you, which is something that really is kind of not that good if you're doing IVF. But it just depends, because I think there is this drug or hormone that you're injected, which is called human chorionic gonadotropin. I think, I don't know if I pronounce it well, but it's kind of like that. Yeah. I think some symptoms I've heard is
My poor aunt.
Yes.
Yeah.
Oh my gosh, it's gonna hurt
No,
so
but
much.
there's not all risks. There are also like advantages of that bad. Like,
But yeah, and also like there's abdominal pain. But something I've also heard is that some of the egg retrieval is something that's really, really painful.
oh yeah.
Okay, I think you are confusing the eggs, right?
Yeah.
No, the eggs is
Like,
is
woman, I don't see like any eggs in woman.
no,
They're
it's like
inside you, honey. They're inside you.
Okay, I understand that. Like it's inside me.
yes, in your uterus.
You
The
have
follicle.
you menstruate, right? Like
Yeah.
that's if you didn't menstruate, that will be a problem. You should go to check to a doctor because you like what you menstruate is the eggs that didn't fertilize. So yeah.
Oh, and also the egg retrieval complications, because I think sometimes when they are using the needle, because you said your poor aunt.
Poor
Because
Huha.
yeah.
Oh, sir, poor Huha. I can't. No. Like
Yeah.
only imagine that pain. It's like
In her
oh
Huha.
God, I'm oof. I can't.
Oof. Okay, well, there might be some consequences from this needle and everything, like an infection or inside bleeding. Yeah, it's really not that good. But there's also advantages, like the high success rate of the pregnancy, and this also is proven by the Kardashians.
Yeah, and also it helps a lot of older people that about 40 years old, 42, that they want to become parents, so they can do that way. Like there's a lot more of advantages has IVF.
Well, yeah, I think this concludes our episode today. I hope you understand more about what this is.
And how it works.
Yes, and good luck to your aunt, Mika.
Thank you.
Hope you see our next episode about brain surgery. Bye.
Bye.